So if
Getting even like contracting pneumonia was actually caused by cold water.
no,
My oldest need. Don't take too much cold water.
or being outside in the cold and not wearing your sweat. Well, the truth is all these infections are spread by inhaling somebody's air that has coughed in the air. So if I'm in this room and I've been coughing I've been having bouts of cough, and then you come in and sit right here, the air, remember the viruses, they stay in the air and they finally work their way down to surfaces. So if you inhale when I've just finished coughing, you're going to get that infection.
Welcome back here on Pediatrics To Go, where we talk about pertinent pediatric information in our world today. We have Dr. Ekuase Sanusi here, and she's going to be talking to us about upper respiratory tract infection. Hello, Dr. Sanusi, and welcome back on this channel.
Thank you, Francisca. Today, the reason why we think that it's very important to talk about colds and upper respiratory tract infections is because 80% of the children we see on a daily basis come in with colds. Now, a lot of times parents say, doctor, my child has been coughing and the cough is so horrible, they can't sleep at night. There's various reasons why children cough. And when you have a cold, it's like having irritation and mucus in your lungs, so you have to cough. We tell parents that cough is actually a good thing. When children cough, it means that they're clearing their airway. And the reason they're clearing their airway is because there's mucus in it. And the reason there's mucus in it is because there's an infection. Now, most children, when they have colds, it's usually viral. From COVID, people learned a lot about viruses because they realized that with viruses, number one, a virus usually will take about 7 to 10 days to run its course. Same thing with COVID. COVID is one of the many viruses that causes colds. But we're not talking about COVID today, we're talking about colds. So we have rhinovirus, we have like 10 different viruses that are very common and they cause colds. So when children come in and they've had a cold for 2 or 3 days and we examine the children, what are we checking for? We're checking to make sure that there's no ear infection. Because a lot of children, they start out with a cold and usually it can progress into ear infections. And the ear infections usually is because the mucus from the nose drains to the back of the throat. There's actually a tube that connects the back of the throat with the ears, and sometimes in small children less than 5 years old, it's common for them to have fluid drain from their nose into their ears, and that fluid gets infected with bacteria. Then they have an ear infection. Then they need antibiotics, because remember, antibiotics only takes care of bacteria. Antibiotics does absolutely nothing for viruses. So most times in pediatrics, we have children coming in, they've been coughing, they've had a cold, they've had a fever, we check everything, and apart from the runny nose, they don't have ear infections, they don't have anything else. If they are not wheezing, we tell moms and dads, don't worry, drink a lot of fluids. When you drink a lot, you pee a lot, you are flushing out the infection. In 7 to 10 days, they'll be fine. But if by the 7th day, they're not doing better, or if they're getting worse, they need to be seen again because there could be an ear infection that has just developed after a week, or there could be a sinus infection. So if you've had a cold for more than a week, your mucus is yellow, the cold is not getting better, it's not following the normal progression of a cold. So by 1 week of having a cold, if you're getting worse, see your doctor again so that they can prescribe antibiotics for either a sinus infection or ear infection. Or if you just need to drink a lot more fluids, you want to just see them to make sure that you don't need antibiotics by 7 days. Some children, when they have a cold that is not going away, you know what it is? Asthma. They could be wheezing. Some children, they have a cold, especially when at night the cough is so horrible. The other thing we're seeing is allergies. If you have allergies, you have enlarged nasal mucous membranes that are producing mucus. You can have postnasal drip, so you have a cough at night. And the history is usually classic. There's a family history of asthma, there's a family history of eczema, there's a family history of hay fever or food allergies. So a lot of those children, they need to be on antihistamines like your Benadryl, your Claritin, which are all over-the-counter medicines. The antihistamines will dry up the mucus. When it dries up the mucus, the cough goes away.
We have that in Nigeria.
Yeah, we have it.
Okay.
It's over the counter, and they are common medicines, but they're allergy medicines. So some children need allergy medicine, especially if they've had a cough that is worse at night and it's been going on for 1 or 2 weeks to months, and especially when you listen to their lungs and their lungs sound clear. Now, asthma is a whole different topic, but when children have coughs and they're always coughing, or they walk into a room and you sprayed anti-mosquito spray and they start coughing or they're getting short of breath, that's a whole different ball game. They need to be on asthma medicines. They need to see their doctor who will prescribe the right medicines for them, and they'll get better. So colds are common colds. We call it the common cold. And rhinovirus is the commonest reason children have colds. Rhinovirus is just a virus that it's rhino because it affects the nasal mucosa and it causes mucus. Anytime you have an infection, the body produces antibodies, and basically the immune system goes into overdrive to get rid of that infection. That's why your nose runs, you have the cough, you have the cold, you have the fever, plus you might have the fever or not. Most colds usually will run its course 7 to 10 days, but if it's not getting better, the other thing you could have is a pneumonia. Pneumonia usually can be a secondary bacterial infection after a viral infection has weakened your immune system. And many times if you go to your doctor, they will hear rattling in your chest. That's not normal. Some doctors will treat for pneumonia based on clinical symptoms, because sometimes you don't always need an x-ray to diagnose pneumonia. You can actually say, I hear what sounds like crackles or rails, and those are all the noises we listen to with our stethoscopes. Those stethoscopes are actually like magnified microphones. So when we listen to any part of the lungs, we can hear what you would otherwise not hear. And some doctors will say, let's just treat for pneumonia. And the treatment for pneumonia is the same as ear infection. It's actually the same as sinus infections. And most times you want to do the penicillins. But see your doctor so that they can put you on the right dose, because based on where the infection is, the dose can differ. And if you need to be on antibiotics, it's usually 3 times a day versus if it's ear infection, usually twice a day. But the antibiotics generally are the same for upper respiratory infections if you need them. So if
getting even like contracting pneumonia was actually caused by cold water.
No,
My goodness, need.
No,
or take too much cold water.
Or being outside in the cold and not wearing your sweat. Well,
exactly. I know.
The truth is all these infections are spread by inhaling somebody's air that has coughed in the air. So if I'm in this room and I've been coughing I've been having bouts of cough, and then you come in and sit right here, the air, remember the viruses, they stay in the air and they finally work their way down to surfaces. So if you inhale when I've just finished coughing, you're going to get that infection because you've just inhaled my germs. And that's why it's important for people to cover their noses or their mouths when they cough, and preferably to cough into your sleeve or cough into tissue, and always wash your hands when you wipe a child's nose, or when anyone is dealing with mucus. All those are secretions that are infectious, and mucous membranes, and all that mucus. If you blow your nose and touch the door and somebody else opens the door, that's how all these things are spread. So that's where most people get colds from. And that's one of the commonest reasons that we see colds in the office. So just that's really colds in a nutshell.
Upper respiratory, what do you call it?
Upper respiratory tract infections. Okay. We call them URI, upper respiratory infections, but in Nigeria, people tend to like to put the tract, so URTI. But the bottom line is a cold is a cold is a cold. If you are not getting better after 7 to 10 days, please see your doctor, because it's not normal for just an ordinary cold to last more than that. And if you're having colds all the time, like every month most people will have colds 3 times to 4 times a year. If you are in school, you can have it every other month. But if you consistently have a cold or cough, then that is leading more towards asthma or allergies. So some people have dogs in their house that's making them chronically congested and coughing or sneezing, and that could be your cats that you're allergic to. So we always recommend get your doctor to check you out, and if you need whatever care you need, they'll be quick to, or they should be quick to.
Is contract cold like when you're asthmatic?
Sorry?
It's easy to contract a cold when you're asthmatic.
You can have cold symptoms when you have asthma. Okay. Asthma is a whole different ballgame. It's more genetic. It means that you have very sensitive airways and your airways can close up, so you're more at risk for shortness of breath. And you might have cold symptoms, but asthma is a different pathophysiology, but it can present like a cold. So if you have a child who has asthma and they're wheezing, they need more than just drink a lot of fluids. They need steroids, and that will help to decrease the narrowing of the airway. So that's a whole different pathophysiology that is beyond the scope of what we're talking about today.
Okay, so is it possible, like the symptoms of like upper respiratory infection where children cough aside mucus, they also cough out blood?
Now that is more like TB. It's not common for children to cough out blood. Now, if a child has had a nosebleed and they are coughing and they throw up and there's blood in the vomit, that's because the nosebleed made them choke and then they coughed up the blood that they had swallowed from the nosebleed. That's totally different. But if they're coughing up blood, let your doctor know. They'll probably want to do a chest x-ray because some pneumonias can make you cough up blood. TB can also make you cough up blood. So, and TB we have a lot of people that have been exposed to people who have TB and they don't even know it. So if your child is coughing up blood, they need an x-ray, they need to be examined, they might need to have TB testing. And that's a whole different topic for another day. But anytime you have a cold, especially if your child is not immunocompromised, make sure your child is drinking a lot, peeing a lot, at least 5 to 6 times a day. And as long as your child is peeing a lot, and you don't have to give them necessarily water, give them chicken broth, ORT, you can do Sprite or ginger ale, especially if they're over the age of 2, and just make sure that they're drinking. If they don't eat, we don't care. As long as they're peeing a lot, drinking a lot, they'll be fine.
Thank you, Dr. Sanusi, for always enlightening us. This is really, really, really good to hear, because if you're not like educated in these aspects, one could just overlook cold and be like, it's just cold, and then it gets really bad, deteriorates, and then your child just like.
Yeah, well, now if it's cold outside, especially if it's very cold, if you're in the cold countries, you want to dress your child warmly. And if it's raining outside, you don't want your child running up and down, because all those are things that can decrease the immune system. Yes, and put you more at risk to get sick. But usually you have to be exposed to a virus to have a cold. And it's not just going outside that makes you sick. It's a combination of exposure to a virus or a bacteria that could give symptoms, and also just for the fact that your child's immunity is not probably at its best when they come down with a cold.
So anyway, thank you, audience, for listening. Now you know what to do when you have a cold. At this point, this is where you actually have to follow us on our Instagram or YouTube here at Pediatrics To Go, so you can keep getting more and more like informations like this, so that you can have a healthy life. Your children can have healthy lives as well. So until next time, we'll see us again. Have a nice day. Bye.
Bye.